Welcome to More Than Dentistry, where your hosts Evert and Waldo discuss life, dentistry, and everything in between with dentists around the world.
Hello and welcome to the More Than Dentistry podcast.
All right, Waldo, it's nice to be here with you guys again. And today, I think we're very honoured to have Dr. Ashwin Kassan here with us today. Dr. Ashwin is a maxillofacial oral surgeon here in Port Elizabeth, and we know him well as a guy that's connected with us as dentists. But he's also, one of the guys we look up to. And so we're very thankful that you've given us the time, Ashwin, to come and chat with you today. I think I'm going to start off with a very basic question. It's just, how did you get into maxillofacial surgery, or how did that interest you?
Firstly, thank you guys. It's an absolute privilege for you to consider me for this podcast. And maxillofacial surgery has always been an interest to me from the time I studied dentistry. I had the opportunity of assisting maxillofacial surgeons. I also have a cousin that's older than I am that's a maxillofacial surgeon. It was quite inspirational in my choosing this field.
Yes.
So that was an easy path for me. As soon as I finished dentistry, I knew where I needed to go to, and it's been the best choice for me.
So he guided you. Can you put it in that terms that he was influence in you going into maxillofacial surgery?
I had a bit of insight into maxillofacial surgery. I studied dentistry at Wits University, and maxillofacial surgery was one of my stronger subjects. I really knew from then onwards that I wasn't going to be an orthodontist or prosthodontist or periodontist. But and then interacting with him, I got more of an insight into the field, and I started to pursue my direction towards the field.
And how long have you been a specialist now?
I qualified in 1997.
Okay.
So it's many years now. Yeah. So in 1998 I got my official qualification from the Health Professionals Council. So I've been practicing since then, and I've been in Port Elizabeth, you can say, since January 2000.
Okay, so that's been about 19 years already.
Yes, 19 years already. Yeah.
And that in between time, where were you?
I was based in Cape Town,
Okay.
at Groote Hospital as a juniors consultant. The field to speciality in dentistry, I must say, is not for everybody, but it really is very satisfying. If you're interested in surgery, you can choose maxillofacial surgery or oral medicine and perio, depending on what your interests are.
Yes.
Even though it takes a long time, it's definitely worth it at the end of it all. It's opened various fields for me. It's introduced me to different people, and treating patients with severe deformities has been very, very satisfying.
Yes. I think you're grabbing onto the point that I was wanting to make about just giving the listeners a little bit of an insight into maxillofacial surgery. I mean, a lot of us, like I mentioned earlier, starting out in dentistry, we don't really know what it's all about, and a lot of people don't find themselves knowing that early, like you knew that you wanted to do surgery. So there's still people don't know what direction they wanted to go, and I would love, that's why I wanted to do this podcast, is to give them a little bit of an insight into maxillofacial surgery. What is your normal day look like? Do you consult a few patients in the morning? Do you have a list in theatre? Do you do in office? I know you mentioned sedations.
So maxillofacial surgery, is a speciality of dentistry, and it's common to dentistry and medicine. You're treating diseases of the face and the mouth. So you're treating a variety of different disorders, from craniofacial disorders to temporomandibular joint disorders, to oral medicine disorders, cleft lip and palates, patients with facial deformities, and then the normal oral surgical problems, cancers of the mouth, different oral surgical diseases, pathologies related to the jaws, impacted wisdom teeth, and then doing dental implants. I really, was quite excited. I'm quite good friends with Conrad von Hagen, who's the team doctor for the Springboks. So on Sunday after the World Cup, he phoned me and he asked me for some advice on Andre Pollard's blowout fracture. So I was able to give him some advice, and that was quite nice for me. As to whether he was safe to fly and the rest of it. So that's the spectrum of that of the field. It does. I think maxillofacial surgery is expanding these days into a lot of craniofacial and head and neck surgery. So more of the modern I'm singly qualified, so I'm dentally trained. But I think the tendency these days is to study medicine and dentistry because the field of maxillofacial surgery is expanding, and also that's the international trend.
And there's a lot of overlap nowadays with your plastics and the neuro guys and the ear and nose and throat guys, and you guys work well together.
Yeah, with all these complex facial diseases, it's a multidisciplinary team.
Yes.
So you work as a team, and the patient benefits from an input from plastic surgery, from ophthalmologists, from last night for a matter of interest. I worked with Conrad Hoekstra, who's a plastic surgeon, and we did a combined operation for a patient with cancer of the mouth. But a normal day of a maxillofacial maxillofacial surgery is quite an intense profession, but it's enjoyable to me. You start off your morning by doing ward rounds and visiting your patients in the wards, and then it depends on whether you're operating in the theatre or you're consulting patients. And at the end of the day, you do ward rounds as well. This also involves a lot of treatment planning and reading around the subject, which is very interesting. Normal dentistry, after you get into the gist of things, you become quite used to planning, treatment planning. But with us, it often involves very complicated operations. And that involves reading up your anatomy and planning an operation, because I always believe that you can't execute anything properly without planning properly. So that's where the interest comes from. I read a lot. I enjoy reading maxillofacial surgery. But like with any job, you also have to have outside hobbies and interests.
I think I remember a time when you told me you're reading some of the stuff, just reading the old anatomy, and I got into the habit before I did the surgeries, was just going through your normal anatomy, and it makes it so much easier when you get into the surgery to know exactly what you're doing and dealing with, and explaining to the patient what's going on.
Absolutely. I think in surgery, anatomy is an absolutely essential part. You learn and you read your anatomy and you plan your operation. The physiology is also important. So somewhere along the line, you get to interact, and that's what's so stimulating about.
I think when we look at young dentists, we always want to encourage them to do continued education. In your line of work, is that also important? Is there lots of courses and things that you attend?
Absolutely. I think I'm involved in a lot of different organizations. I'm currently on the Maxillofacial Society, on the executive committee. But besides that, I'm also involved with a very interesting NGO that's called the AOCMF. So it's an osseointegration. Sorry, it's a Swiss-based organization for craniomaxillofacial surgery. And at one stage, I was quite involved in training African surgeons, maxillofacial surgeons.
Yeah.
So this network of people has allowed me to meet maxillofacial surgeons from all different parts of the world, and it's introduced me to different training aspects. I've recently been for different levels of training, how to train the educators and how to do media training, television, broadcasting, podcasting, webinars, the rest of it, you know. So that's the interesting part of it, you know. So it's taken me to different heights and
broadens your spectrum.
Absolutely. So it makes it very interesting, especially being in Port Elizabeth, you know. We tend to be a bit isolated from the bigger cities.
Yes.
One thing that bothers me, in particularly sometimes when I have a case that I'm worried about, or I've done a procedure, and I sometimes go home and I still worry about the patient. And what do you do with these cases like you did last night, where you have this massive involved surgery? How do you debrief yourself? How do you relax and get calm and quiet at home?
This is a question that my wife always is quite amazed. I think it's a personality thing, and it comes with experience. You know, I think communication with your patient is very important, and consent taking is extremely important. So, with experience, you'll gather that before the operation, you need to explain to the patient that these are the complications, these are the potential complications, you know, besides costing of an operation, there are other aspects. And that helps you a lot, you know, after going through a complicated procedure. At the end of it all, if the patient is quite ill or very, very swollen, you've already covered a lot of it.
Yes.
And you have to learn a technique of being able to go home and being able to switch off and have time for your children and your wife and your friends and yourself. You know, myself and Valdo have worked together for many years, and it's amazing. I mean, he's got into CrossFit training and he's done a lot of different things. So, you know, he's been through all different aspects, you know, as a naughty student to a good parent.
While we're on the lighter side, I don't think this is a light thing, but can you remember, or you probably will remember this case that we did in the Medical Forum Theatre?
Yes.
Where we were hunting for a partial denture.
Yes.
Tell that
Very,
story
very,
to us.
very interesting case. You know, sometimes patients demand certain things of you, and we had a lady that happened to be an estate agent, and I was doing a procedure for a bone grafting and ridge augmentation in the anterior maxilla, and she insisted that she wants to wear a partial denture, a two-tooth partial denture after the procedure, which I did, and it was a busy day and there were lots of patients and she was being recovered, and I went out to look at her in the recovery room, and she smiled and whatever, but I couldn't see a denture. And then, you know, I asked the sister, and then the sister looked all over, you know, in between the linen and in the bags, and we couldn't find the denture, little realizing that she had aspirated this, and this was lodged in a posterior or upper airways. And we were fortunate enough to be able to get this retrieved. You know, ever since that, you know, you learn with experience, and you learn more from the bad experiences than the good ones. I never ever put a small partial denture in the patient's mouth. especially after a surgery, or unless they have recovered properly.
Yeah.
So that was quite a funny experience, funny but scary experience.
I think that a lot of the times with experience comes awareness of what's going on in a situation, and it's perceived from the outside as a calmness that this person has got when he's doing things. He looks very calm, but your mind is, even though you're calm in your actions, your mind is busy processing quite a lot of things, knowing out of experience that you don't put a little partial in somebody's mouth, and knowing from experience that this is, so there's a lot of things that that comes with time, you know. Even and that it is also like a little bit of advice to the young guys starting out, is that, you know, some things will happen with time.
You know, the one thing I must tell you is that I've learned with experience, and I must mention this, is that complications can occur, right? Complications happen to dentists, they happen to specialists. They're more tolerated in the hands of specialists, I must say, and unfortunately sometimes you go through years of experience before you learn this, you know. And if you're a young person or young dentist starting out, honesty is very, very important. If you've had a complication, just be honest to your patient, explain to them what has happened, explain the fact that there is a specialist that you'd have to refer them to, communicate with your specialist, and I tell you that solves a lot of problems.
For sure. I think
so, you know.
Yeah, to connect with that, with honesty, and a lot of the times we're talking about the consent initially. That's a conversation that people tend to run over before a procedure, because they just want the patient to say yes to the treatment. So they're not making the patient fully aware of the consent that they're signing to. And I think that's a very important point, is to when you're doing consent, is to be very detailed, very thorough in regards to possible complications.
You know, absolutely. You know, the consent taken is so important. You know, we go through this we all also learn it by experience. I think these days, even recording a consent is acceptable, but just explaining in simple terms, you know, what the patient is to expect. And then also, like in England and in Americas and the Western world, you know, insist that you give your patients all different options. If you were to replace teeth, tell them the option of implants, the costs, or what are the alternatives, you know, and what are the complications of that. The other important thing that I must say, is that when taking medical histories, I find it always, and I always taught dental students to take a verbal medical history. Because patients, when they're filling in forms, often think that it's not necessary for a dentist to know that they're on Plavix or blood thinning agents or whatever. So by taking it verbally, you are already getting an understanding of what the patient is like. If the patient is on antidepressants or on anxiety medication, you know how to tolerate your patient, or how to schedule your appointments and the rest of it, you know.
So another thing that's been happening in the world of dentistry is technology has just gone forward so quickly. What is I know that the CBCTs and things are becoming almost mandatory for a lot of these procedures. What's the equipment that you can't go without? What's the things that if you didn't have this thing, you couldn't practice what you're doing at the moment?
I think, you know, I'm at the stage where I'm a very techno-friendly guy. I mean, my house looks like an eye store, but you definitely can't go without. These days, if you're doing implant surgery as a dentist or a maxillofacial surgery, it's absolutely essential to have a CBCT. Right? Secondly, a good thing that has really helped me in my practice a lot is a set of loops.
Yes.
Right? I think loops really help you.
Yeah.
And the other technological things, you know, that assist your practice. It really makes life easier. I mean, I bought myself a portable X-ray unit.
Yes.
A handheld X-ray unit, which is something that has really changed my outlook, my practice of dentistry.
Yes. Especially in theatre now.
Yeah. And technology and computers and the rest of it, you've got to keep up with the times. We do use a lot of 3D planning and 3D printing in maxillofacial surgery. Like you guys use a lot of digital work, Sirona, CIRAC work, and that type of work. You can't practice modern dentistry without that.
Yes. And it's made the field interesting and so much more satisfying to do these things. You know, even planning cases.
If patients know that they're going to come to a centre where the crown is going to be cut or the implant is going to be placed and they're going to walk out with a tooth, that's the centre they're going to go to. Whichever way you like it, that's the way dentistry is going, because people have less time, you know, and they're prepared to pay a little extra for it, rather than to wait 2 weeks for their crown and to wear it temporary. That's the way things are, you know.
I think, Waldo, you always like to move on to the more than dentistry part of it.
Yeah, I think before we get to that, I think the one thing that I've learned from you is a procedure called a coronectomy. And there's not a lot of surgeons that actually do a coronectomy.
Yes.
As I understand it. I like the concept, and I like the risk aversion that we're actually having by doing a coronectomy. But what is your parameters? When would you consider doing a coronectomy, and what is a coronectomy?
Okay, coronectomy, firstly, there's good science to back this up. Like there's also good science to back up a socket shield procedure these days. But a coronectomy is indicated if you have impacted wisdom teeth or other impacted teeth that are close to vital structures. Like an impact, I'm going to use the impacted wisdom tooth as an example. That's close to the inferior alveolar nerve or close to the lingual nerve sometimes. But in an older patient, we know from studies that over the age of 25, the incidence or the of complications of paresthesias or anesthesias or nerve damage increases, you know, in wisdom teeth. And you get those patients that have symptomatic wisdom teeth with cysts attached to them, or patients with pericoronitis and that need those wisdom teeth taken out, but they're young people and you don't want to damage the nerve. So a coronectomy is a procedure where the crown of the tooth is removed, you know, at the CEJ, at the level of the CEJ, and the roots are left submerged together with the nerve in place, but it's below the level of the bone, okay? So in that way that you're sparing damage to the inferior alveolar nerve, and then you don't put any medication over that area, and you try and achieve primary closure by means of mattress sutures. You advise your patient of this procedure beforehand, and in most of the cases they heal very well. And if there is a problem, you know, with infection at a later stage, you then justify to go in and carefully remove the root. I've done many of them, and I've had very few complications, and in the few complications that I've had, the root is actually loosened up and moved away from the inferior alveolar nerve. So I think in that way, you know, you're achieving something. And very often it's the crown and its relationship to the adjacent tooth or the overlying gingiva that causes the problem. So by removing the crown, you sort out the problem. So it's a standard in my practice. I give the patients the option.
That's great. Okay, well, let's move on to the more than dentistry part. And this is something that, who's Ashwin outside the practice, when the tools are down, when you go home, and you and Farah at home, what do you do? What's your interests?
Look, I'm just an ordinary, normal person. I'm not, maxillofacial surgery is my hobby, I must say. I enjoy it. But I'm also just an ordinary person. I enjoy, these days I've got myself, I make sure that I exercise at least 3 to 4 times a week. Not as often and as hard as Valdo, but
nobody does.
But I do some biokinetics. I think it is absolutely important that if you do any profession, that you have to be, there's a level of fitness. You need to do some sort of exercise, especially as you get older. I enjoy traveling a lot. I do enjoy listening to music, all different types of music. I socialize a lot. I have a nice circle of friends. I have friends outside of my profession. So very ordinary people. We've traveled. My profession has taken me to many different places. I have a very interesting wife. We decided, we married late, so we don't have any children, but she was involved in radio and media for many years. So we have a very interesting group of friends. And that's it. We enjoy art, enjoy reading, enjoy music, and then just enjoy life. I must say, one thing I've got to say is that I'm proud to be in South Africa. I love my country. And I also believe that for all the negative things, there's a lot of positive things happening in the country. And for as long as I'm going to be here, I'm going to offer some sort of benefit.
That just speaks to my heart, because I love South Africa, and I sometimes wonder, why are the top guys still staying in South Africa? Because they can you can practice anywhere you want to, but there's something about South Africa.
As in dentistry as a profession, South Africa, for a small country like we have prominent people in different fields all over the world. But looking at our profession, dentistry, maxillofacial surgery, there was a very prominent maxillofacial surgeon by the name of Lester Brown, who was in charge of the Maxillofacial Society in England for many, many years, from Wits University, from Johannesburg. The dentists and maxillofacial, all specialists all over the world from South Africa. So, we shouldn't, our education is excellent, our experience is excellent, and you only realize that once you meet an international contingent. They all want to come to South Africa. We have nature, we have wonderful people, we have diversity of cultures and religions, and what better place to stay?
Yeah, I think if you look at people that travel, the more you travel, the more appreciation you've got for South Africa.
I think the more you travel, the more you learn about yourself. I think culture, religion, and respect. Tolerance is very important. I'm Hindu and I'm married to a Muslim lady. We are not very religious, but we're spiritual. We go to church on a Christmas day and we'll sit, and because it's just respect and tolerance. And you never. The one important thing is that I never stop learning. It doesn't mean that I'm a maxillofacial surgeon that's in practice for 20 years that I'm not going to learn anything from both of you guys. We learn all the time. Valdo's taught me so many things. That we've worked.
Sure. Ashwin, when it comes to, have you had a case, not a case, but have you had adversity in the past or maybe a life-changing moment that you think, this has changed my course during my life? Is this something like we spoke about earlier? Sometimes something bad happens and we learn from that. And do you have a story like that maybe for us?
Look, I think all of us have complications, different complications. We learn, obviously, as surgeons, we're used to complications because we treat complicated cases all of the time. But an experience for me that was a very important, life-changing experience was that in March this year, I got very sick with a pneumonia, and they were querying as to whether I had tuberculosis, and I was critically ill and booked off from work for 2 months. Fortunately, I was in the hands of excellent doctors, physicians, and a partner, my wife, and I was nursed back to health. And during that period, it really was a thinking moment for me, A lot of the time, my wife kept on telling me it was probably because I was working too hard and not taking time out to do different things, which I think she was probably right. My physician, Dr. Mo Jansen, who also was absolutely amazing in teaching me a lot of different things outside of healing, but outside of the medical side of things, by just getting your mind, he insisted that I take 2 months off from work, and I had to get my mind in the right space. Which brings me, back to an important point, that all younger dentists, you must make sure that from day one that you have the proper disability insurance. That is absolutely essential. An experience to give you was that when I was at dental school, when we finished dentistry, our dinner was sponsored by the PPS. And we had they sold PPS policies to us. And I had a colleague of mine that was a pharmacist beforehand and then worked as a dentist in the army and then studied dentistry. So he was older and he had a PPS cover and he had a practice he was about to start a practice in, I think it was Umhlanga or Belito in Durban, but met with an accident, after his graduation and lost his right arm. So he wasn't able to practice dentistry, but he went on to study an MBA and he became a good pharmaceutical person, but that is where the PPS, and I fortunately had good cover from the PPS and whatever, so that is a very, very important consideration to all of us. Max your PPS, your disability insurance, because you never know. If you were an adventure guy like Waldo, a 100k weight may fall onto your arm, and you may be off from work for a while, or Altus, so that's important. So that was really a life-changing moment, so please, you've got to take some time out of things, and you've got to do things to de-stress and get your mind into a good space, because by doing that, you treat your patients better, and things will work out,
What was some of the things that you realized, if I can put it that way, in that 2 months of being away from your work, maybe about your life, about your work, that you now maybe implement after that time?
For the first couple of months, I started doing things perfectly. But after the 3rd month, the folders are still sitting here. You get back into the old bad habits, but you've got to take time out. You've got to make sure that you take the necessary time out. Your patients will understand. If you need to take a holiday, you tell your patients, listen, I'm sorry, I need to go on holiday. And it's absolutely amazing that they understand and they're happier that you will come back rested and treat them. That's one thing that I realize. Secondly, it's important to spend time with your loved ones. Because time goes by so quickly, you know, and take time out just to, simple things, you know, when I was sick, just to get to the beach and lay on the sand, or to pick up a book and read. But I also started missing my work a lot.
Yes.
You know, which made me think that I couldn't wait to get back to work again.
Sure.
You know, so it's a balance of life. You know, not everybody achieves that, but your work should be a hobby. You know.
Yeah, it's nice if you can get to work.
Yeah. And all of us, you know, you. It doesn't mean that because you're a specialist, or you have to be a specialist to enjoy that. You can be in your own space, but if you're a general dentist, try and find a field that interests you and go forward and study further and make it and promote yourself, you know, because I think even in general dentistry, you've got to sort of super specialize your work these days. You know, I think it makes your work a little more understanding.
Yeah. But
I mean, much more enjoyable.
Yeah. Well, what's your stance on the general education sphere that we're in now with the universities, and we have got a lot of postgrad private institutions training guys in more specialist fields?
You see, that is the way the universities, what I find is that the older, more experienced teachers are all retiring, and there seems to be very little succession planning in universities. So what the result is, your educators are becoming younger, and unfortunately your teachers need to be more experienced, right? So it is, the onus is upon yourself to try and seek out different external educating sort of platforms, and go, and you have to spend money and go do those training as required.
Yeah, I had a conversation the other day with one of my colleagues, and he said, going to this private institution, it's a lot of money. I said, you know what, if you go do a postgrad diploma at the university, it's not a knock on the university, but you spend 2 years doing a postgrad diploma at the university. You spend about 2 or 3 weeks at the university. You learn a lot of things, but the amount of time that you take out of practice, it might, on the bottom line, looks cheaper, but that time out of the practice costs you a lot more than going to a private institution in those weekend successions that you work and pay that money, and you actually get decent work. They cut to the chase and learn you the things.
Yes, you know, the secret is now these days, you know, you have a network of people.
Yes.
Right? And you guys have done a great job by doing this podcasting, you know, so through that and different WhatsApp groups and different ways of communication and the internet, you can work out for yourself, you know, whether you need to go to, and the specialists do the same. There's so many different things happening educationally, and remember, education is not only about educating yourself in a certain field, it's about networking with the correct people.
Yeah.
Right? Meaning that if you're interested in implant work, you know, a certain type of implants, you will go to try and find out which is the most suitable training course, and you will find people that are interested in the same field, and you network with them. And with them, you form a network of friends.
Yes.
And you will be amazed as to how much you learn from them. You know, and that is being done all the time now, you know. So, and that's how you become an expert in the field.
We found that networking immensely powerful and valuable, and that's something I would also encourage the young dentists out there is to start networking, connecting with other dentists, connecting with specialists, connecting with people and assisting them, learning from them out of their experience. It's such a valuable thing.
I was, as part of this conference that I went to, this AOCMF course, one of the things that we planned was the question arose, what is a young surgeon, right? So the age of a young surgeon varies from country to country, but we were involved in planning a conference for the future for younger surgeons. So firstly, younger people are more computer literate. They want to go to areas that are of interest to them, So they will be they want to go to, let's say, interesting places. They want to network with people that are prominent in the fields. So they want a one-on-one experience, They're not prepared to sit in a full day of lectures, 5, 10 lectures. So you need to try and work out a medium that's suitable for yourself.
Yeah.
You have to spend the money. It's a tax-deductible expense, right? You can make it a holiday for you and your family. That's what I often do. With my wife, we see different places. I know so many maxillofacial surgeons and dentists through my interest in implants and other fields all over the world. And you become a global community.
Wonderful. The one podcast that I listen to is that Dentistry Uncensored. It's an American one, and the one thing he does, this dentist, he basically he asks the reps that comes to his office, what is that goes around quite a lot of offices. He would ask them, what is the guys that you see are quite successful? What do they do that I'm not doing? Or what can you see these guys are doing that's happy, that's the most productive, the happiest, the best dentist out there? And the one thing they say is that those people do a lot of continued education, and they quantified it to 100 hours a year. If you do 100 hours a year of continued education, then you will be happier. So it's one of those things that we advocate quite a lot on this podcast, but it's to continue your education, continue in the line that you find interesting in your field. Now, even with podcasts, I listen to about an hour of podcast every day. So I throw that into my continued education. There's so many mediums these days. I mean, you can read books, you can spend time with colleagues, you can go assist, you can do online courses, you can go on these courses overseas. The world's out there for you to go and learn all these things.
Absolutely, it's just there's enough out there to be able to learn. So you have to develop an interest in a particular field and then hone in. You can't know everything, very well. There's certain things that you will know and do better than the others.
Yes, for sure.
I think we can start ending and off here. If there's I think you've already given one piece of advice for the young guys, getting some indemnity cover.
Yes.
But if there's one other thing that you would think is, if you would have changed anything about how you started to practice, or maybe do exactly the same, what would be something that you would either buy or do?
I most definitely will tell you, you've got to keep up with technology, never stop learning, and you've got to offer your patients the best. And dentistry is an expensive profession. But so every couple of years you've got to change your equipment. You've got to, and the patients want to see new technology. The minute they see new technology, they will be there. And you know what? The other thing is also communication. You've got to learn good communication skills. You've got to be friendly with your patients. And the art of planning appointments in your book is a very skilled art. You know, you've got to look at because dentists, I think, like all of us, you're pushed for time. And the time makes you irritable if you can't manage your time properly. So time management is absolutely important. I think we should all have more education about that. Your ladies in the front need to be trained because they promote your business. They're your face. And they got to adjust your book according to you, your personality and so it's an art that it will differ from person to person, but it's something that you need to master. Keep up with technology, continue learning, right? Plan your day. Time management is very important. Spend time with your family and yourself, and you'll be a successful person.
I think that almost encompasses everything that we stand for in the podcast is all of those values, and it's so refreshing also to hear it from more people, and we didn't even come here to talk about that today.
And Waldo, it's so important. I mean, I know you guys have put a lot into making your practice attractive and all of that. I think a lot of dentists should understand that every couple of years they need to change the environment. It's good for their soul, and it's good for your patients. So you've got to invest in your business. It's necessary.
Well, I think it's the nice thing always is I can always refer my patients to you with a happy heart, that I know my patients are in good hands, and my patients, when they come back, they always tell me what a great experience it was to go and see Ashwin. So just want to thank you for that. That's really, really, such a nice thing to do.
Thank you very much. My head is very big now. Very, very important.
Ashwin, thank you so much. You're such a stand-up guy, and we value you, and thank you for being so humble and always being open to chatting with us as the dentists. You make us feel welcome, and you're very approachable, and we appreciate that.
You must understand that without you guys, we can't practice our profession. So you as dentists are important to us, and thank you for doing this great job. I mean, the podcast is really important. I think everybody will benefit from it, and just keep on with the good work.
Thank you.
Thank you very much.